Okay, in the interest of time, we'll go ahead and get started. And folks will trickle in as they come. So hello, everyone, and welcome to today's training, the COVID-19 Vaccine Explained. This training is going to walk us through the basics of the COVID-19 vaccine, how it works, and I hope that we can all walk away with a better understanding of the facts about the vaccine. And hopefully some of you were able to join the open town hall webinar we had a few weeks ago where we heard from a couple DSPs. We heard from Earl from ARC and Janet from SEEK, and they told us more about their decision-making process and their experience receiving the vaccine. And we really want to make sure that everyone has the information that they need to guide their decision-making. So we want to take some time out, even today on this training, once we have completed the training, to address any questions or concerns that you have about the vaccine, as I'm sure many of you do have questions. So while the training is going on, feel free to use the Q&A feature to ask any of your questions. We're going to take note of the questions as they come in, and we will answer them at the very end of the presentation. Just so that you know, this is a recorded webinar. And so you will be on mute, but again, you can use the Q&A feature, Q&A box for questions. And feel free to use the chat box to ask any other questions or make any comments that you have. So before I hand it over to Dr. Phoenix and Sydney Robinson, who are going to be leading our training today, I do want to administer a quick little poll. So it's a 3-question poll, and it probably will take you 30 seconds to do. So you should see it on your screen for those that are joining via computer. So you should be able to see this, the poll right now. All right, I see some responses coming in. Thank you. All right, I'll give 10 more seconds to those who haven't filled it out yet, and then we will jump right in. Okay, perfect. Perfect. Thank you all for submitting your answers to that. So without further ado, I'm going to hand it over to Dr. Phoenix and Sydney from the grant group, who will be leading today's training.
Good afternoon, everyone. I'm Dr. Phoenix. I'm a senior consultant with the grant group. I'm joined here today by my colleague, Sydney Robinson. Sydney, would you like to introduce yourself?
Sure, thank you. Good evening, everybody. My name is Sydney Robinson. I will be facilitating the training alongside Dr. Phoenix.
And I am still seeing the poll. Okay.
You still see it now?
No, it's gone now. So let me start off by saying that we were asked to conduct this training to provide you with some information about the 2 vaccines that are currently authorized for use in the United States. Some of you may have already been vaccinated. Some of you may be waiting for your second shot. Some of you are waiting for the clinic days to happen. Wherever you may be in the process, we really hope that this information in the training session today will be useful to you, helpful for your decision-making process. And we're going to ask you to save your questions for the end, and there should be plenty of time to respond to your questions. Today, we will be talking about reasons to be vaccinated, how the vaccines work, how you can get the vaccines, as well as some common myths that are circulating. Slide 2, please. So there are many reasons to get vaccinated, but probably the most important is that getting vaccinated with either the Pfizer or the Moderna vaccine will protect you from serious illness. So it will protect you not only from the milder symptoms that most people who are infected with COVID-19 experience, but it will also protect you from the more serious things, the things that would require you to be hospitalized, to be placed on a ventilator, to potentially have some of the serious outcomes like stroke or long-term illness. Some people are experiencing long-term effects, heart disease, damage to the heart muscle from the COVID-19 virus. So it protects you from all of those things. And the data shows that both of the Pfizer and the Moderna vaccines have been shown to be close to 95% effective. Now, most people who take the vaccine will experience some mild side effects. Many people will have a sore arm, fever, headache, and these are actually beneficial signs. They're an indication that your body is beginning to make the immune cells that can help to protect you from COVID-19. Some people may have to miss a day or two of work. Next slide, please. But taking the vaccine means that we can all work more safely together. And it means that you can be an example to those around you who may be trying to make a decision about whether or not to take the vaccine. The quickest way that we can all as a community get to the end of the pandemic is through vaccination, because the more of us who become vaccinated, the less easy it is for this virus to move around in our neighborhoods, in our communities, in our workplaces, in our state. Next slide, please. And it means that we may be able to get back to business as usual sooner. The more people who take the vaccine, we could resume day programs. We can more freely interact with people in group homes. Caregivers can interact more freely. Next slide, please. Now, we wanted to present some information. This is information that was released recently by the Kaiser Family Foundation. And what they wanted to do was to really look at COVID deaths compared to deaths from some of the things that are the leading causes of death in the United States. So prior to COVID-19, people in the United States were dying of heart disease, cancer, stroke. Those were among the top 5 causes of death. But since COVID-19, from data that was collected during the month of January, COVID has really been the leading cause of death, with more than 3,000 people a day dying. And so that's a lot more than what we were seeing last year from diseases like heart disease, cancer, or stroke. Next slide, please. So I can't say this often enough, but you probably will hear me say it a couple of more times today, that taking the vaccine, either of the 2 vaccines that are currently authorized for use in the United States, will protect you from those serious things that can happen. And I like to think about the fact that if there are 100 people who get COVID-19, some of those people will die or have serious illness, and some of that serious illness will last a long time. If 100 people get the vaccine, there have been no documented deaths. And there may be mild side effects, but they tend to be very short-lived, go away in a day or two. So when you weigh those 2 things, it really seems as if the benefits of getting the vaccine far outweigh the risks. Next slide, please. So we thought it might be useful to spend a little bit of time at the beginning of this presentation talking about how vaccines work. And vaccines really work by protecting us against harmful diseases. They do it by mounting our own natural defenses to protect us against infections. So typically, the body is really very good at warding off things that it thinks might be harmful. So if you inhale something, or if you cut yourself, if germs get into your body that way, or even if you swallow something, your body has a way of attacking those things that it recognizes as foreign to you, and potentially harmful to you. And it does this with antibodies. The antibodies take a little while to be made because they tend to be very specific for the germ that may be causing you potentially to become ill. But there are short-term things that the body does to protect you, and then longer term, the antibodies are kind of a very specific fix for the germ that may cause you harm. It's almost like a lock and key. And the antibodies will recognize that germ time and time again if you come in contact with it in the future. And that's what helps to prevent us from getting sick. Next slide, please. So again, the more people who have these antibodies, the less easy it is for the virus to move from person to person. And that will really get us to that point where whole populations will be better protected, even the people who haven't taken the vaccine. Next slide, please. So what we really want to do is get to what we call herd immunity. And herd immunity can be achieved when we have more people who are vaccinated than not. Once that happens, the virus can't spread easily. In this diagram, you see a family of 5. We think that if somewhere around 80 to 90% of the people in that family are vaccinated, then the entire family would be well protected. Next slide, please. Now, there are some people who should probably wait to get vaccinated. So if you have tested positive for COVID-19, or if you are having symptoms, you should wait until you complete your isolation before getting vaccinated. Next slide, please. If you are immunocompromised, it's okay to get the Moderna or the Pfizer vaccine. The most common types of immunocompromised people are people who have the HIV diagnosis, or perhaps people who have cancer, who are being treated with chemotherapy. If you're not sure whether you're immunocompromised, it would be a good idea to check with your doctor and talk with them about taking the vaccine. Next slide, please. So a contraindication, that's a long word, but it's a reason not to get a medical treatment because of a concern that maybe it could be more harmful than good. And so we're recommending to people that if you've had the flu vaccine, or any other vaccine, you should probably wait a couple of weeks before getting vaccinated with COVID-19. And for people who have had some kind of an allergic reaction, either to a medication or to another vaccine, or to some kind of a treatment that might have to be injected into your body. If you've had an allergic reaction to any of those 3, we have some additional concerns, and probably you need to speak to your doctor about taking the vaccine. All people are being asked to wait 15 minutes after they're getting the vaccine, just to ensure that if they have an allergic reaction, they will be close to healthcare in order to get an injection to help to slow that down. If you have an allergic reaction, typically it will happen within the first 15 minutes of getting your vaccine dose. Next slide, please. I want to talk a little bit more about how that immune response happens. So I talked about the body being really very well able to recognize things that are foreign, that might be harmful. And those things are called antigens. So when the body sees an antigen, it begins to mount an immune response. So there's kind of a short-term response, which is very general. So if you get a cut, you probably notice that you start to swell up, it feels warm. Those are signs of that general reaction. The warmness, the swelling, those are cells that are rushing to the place to fight back against that antigen, to make sure that it doesn't grow, that it doesn't travel to another part of your body. And that foreign substance could be a toxin, it could be a chemical, it could be a bacteria, or it could be a virus. Next slide, please. And as I said before, the infection fighting cells that we mount to fight off those bacteria and the viruses are called antibodies. And they are very specific to a specific type of germ. As I said, it's almost like a lock and key. Now, what's happening with the new variants of COVID-19 that I'm sure you're all hearing about, there have been some coming from the United Kingdom, some from South Africa. All of these are a little bit different than the original strain that has been circulating in the United States. So far, they're not so different that the vaccines don't work. The vaccines that are currently authorized for use in the United States, the Moderna, the Pfizer vaccine, they do still show effectiveness, even against the new strains. The variants are not different enough that the vaccines don't work against them. Next slide, please. So let's talk about different kinds of vaccines. And I wanted to run through this because, all of us have had one or more of these different kinds of vaccines. So measles, mumps, rubella, chickenpox, the typical childhood vaccinations, they're all made with live virus. These are live virus vaccines. They weaken the virus a little bit so that it's not as strong, but it's live virus, and that actually causes these vaccines to be very effective because your body mounts a very strong response because it recognizes that something living has been injected into the body. Next slide, please. So kill viruses. The two examples of these are influenza, the flu vaccine, and the polio vaccine. So the kill viruses don't mount as strong a response as the live viruses. And you may need a booster because the immunity doesn't last quite as long. Next slide, please. So this next group, there are many, many names: subunit, recombinant, polysaccharide, conjugate. Probably the best example is the human papillomavirus vaccine, the HPV vaccine. This is given to young girls, young boys, to help prevent cervical cancer from developing. Hepatitis B is another example. The shingles vaccine is another example. These just target a small piece of the germ. They can be used by people who are immunocompromised because they don't have the live bug in the vaccine. Next slide, please. Toxoid vaccines, diphtheria is one of these. The tetanus vaccine is one of these. They use a toxin that the bug makes that circulates in the bloodstream. They deactivate it and then inject it in order to help you to mount an immune response to that. You may need booster shots for these. If you've ever had a tetanus shot, they tell you to get one every 10 years. The reason is that over time, the immunity goes away and it needs to be boosted by a second shot. So the new vaccines, and the Pfizer and the Moderna are examples of these newer vaccines, are made with a template called mRNA. And mRNA kind of goes into our cells and makes proteins, and that's a process that goes on in every cell of the body. It's a normal process. mRNA every day makes proteins in our body like the ones that break down our food or do a number of different things in the body. Next slide, please. A couple of other examples of messenger RNA vaccines are the Zika vaccine and the one for cytomegalovirus. But those have not been used on a lot of people prior to the Moderna and the Pfizer COVID-19 viruses. So these messenger RNA vaccines do not use live virus. So they can be given to people who are immunocompromised. And they target a particular protein of the virus. In the case of COVID-19, the messenger RNA codes for the spike protein. Next slide, please. So currently in the US, we have 2 COVID-19 vaccines. Distribution has been limited so far, with most states prioritizing healthcare workers. You are considered healthcare workers. Right now, you may not have a choice about which vaccine you get because supplies are limited. Both the Pfizer and the Moderna vaccine are about 95% effective at preventing serious illness from COVID-19. And regardless of which ones you get, they're both very effective, and they are our best weapon against the pandemic. So let me talk a little bit about kind of the shape of the virus. You've probably all seen this picture of the virus with these spikes kind of coming out of it. It's shaped almost like a crown. And in fact, these kinds of viruses are named for that shape. Coronavirus is another way of saying crown-like viruses. And so both of the vaccines that are currently authorized for use in the United States are targeting kind of that little spike right at the tip, a specific protein in that spike. And you can see it kind of looks like a good place to mount an attack because it's very accessible. Next slide, please. So these are authorized for emergency use. So what does that mean, really? That word emergency may be a little scary, but I think we all recognize that what we're going through now in terms of how rapidly the COVID-19 virus is spreading, that it's an emergency for all of us. And this mechanism of authorizing for emergency use is a way that the Food and Drug Administration has to get medicines or treatments developed quickly so that they can be available for something that's very, very serious, for which we have not yet had an effective treatment. So in order to combat what we're considering to be a public health emergency, this emergency use authorization process has been used. Next slide, please. So the Pfizer vaccine requires 2 doses, and you're being asked to wait 3 weeks after the first dose before you get the second dose. Next slide, please. Similarly with Moderna, it's 2 doses, but the dosing schedule is a little bit different. You get your second dose of the Moderna vaccine 4 weeks after the first. Now, you know, there's a little bit of wiggle room in these dosing intervals. So for example, for the Moderna vaccine, if 28 days passes and you haven't gotten your second shot and you get it on the 29th or the 30th day, there's every suggestion that it will work just as well for you. So you don't have to be so frightened if you're a day or 2 late getting that second dose. Next slide, please. And again, both of these vaccines work the same way. The mRNA is injected. It's covered with a little bit of fat to help keep it stable. It's injected into your arm, and then your body takes up the messenger RNA and learns how to make the spike protein antibody. Here's a video describing it. I'm not hearing the sound, Sydney.
Dangers of a virus. So when a virus does show up, it's ready to fight it off. Number 2.
I would suggest restarting it. Can you do that?
Yeah, no problem.
How would COVID vaccines work in your body? Well, I have 60 seconds to tell you 3 things you should know. Ready? Number 1, getting the immune system in shape. A vaccine is basically a training session for the immune system. Vaccines teach the immune system to look for the key features of a virus. So, when a virus does show up, it's ready to fight it off. Number 2, vaccine, meet virus. The vaccine gives your body a plan to recognize the virus. Then your immune system starts preparing by making antibodies, or fighter cells, that stay in your blood as protection in case the virus tries to invade. What this means is you get immunity against the disease without having to get sick first. Number 3, community immunity. When enough people's bodies know how to fight off a virus, it has nowhere to go. That slows the spread. When people get a vaccine, we're able to stop the spread quicker and get a little closer to ending this pandemic. That's basically how vaccines work. And that is 60 seconds.
So why are there 2 shots? For both Moderna and Pfizer, there are 2 shots because it can take a little bit of time for that immunity to build up. The first shot kind of gets you nearly halfway there. And then the second shot gets you to full immunity. As I was saying earlier, it takes your body a little bit of time to build those antibodies. And the antibodies are the specific cells that recognize the specific bug. And that process doesn't happen instantly. It takes a little bit of time for that to happen. So the 2-shot process helps your body to get to the point where you're at that full immunity level. Next slide, please. So I want to talk a little bit about vaccine hesitancy, vaccine mistrust. And a lot of it is rooted in things that have happened in the United States and in other places in the past. 2 examples, the Tuskegee experiment. Many of you have heard about this. So this was research that was done on syphilis on rural Black men in the South. They were denied treatment even after effective treatments were developed. They did not have the ability to get the penicillin shots. They continued to be studied. It was a horrible, horrible atrocity. It has led to some real changes in terms of how research is done in this country. And so now there are safeguards in place so that you have to obtain consent from people before you enroll them in a research study. You have to be able to assure them that the benefits of their participation outweigh the risks. You have to document the consent in writing. And there are lots of protections for special populations, people who may not be able to give consent on their own, like children or people who are experiencing some form of disability. All of those protections were put into place in part as a result of what happened at Tuskegee. So we have moved beyond that. I'm not saying that, that everything is perfect. But a lot of things did change. A lot of policies about research have changed, scientific and medical research. The process we go through to conduct trials to test a medication or any other kind of drug have changed a lot as a result of what happened in Tuskegee. The other example is Henrietta Lacks, an African-American woman who had cervical cancer. She went to Johns Hopkins for treatment. They were not able to save her life, but in the process of treating her, they extracted some cells from her body. And it turns out that those cells were very, very useful in helping us to test and develop cancer treatments. But she did not give consent for that to happen. And although those cell lines have really turned into a very profitable enterprise, her family was not compensated for the fact that her cell line is what led to these new developments and treatments. So these are 2 examples of some of the reasons why people may be hesitant about new medications, about participating in clinical trials where medications are being tested and treated. This is where the hesitancy comes from. Next slide. And so we find ourselves in a situation where people of color are dying more from this awful disease. But we still remember these historical incidents that really were bad examples of how people of color were treated, either in the course of a research experiment or even in the process of trying to get treated for some kind of an illness that they may have had. Growing up as a little girl, I can remember my mother talking about her experience going to Hopkins and seeing the signs for the bathrooms. You know, in the 50s, we still had very, very segregated systems. And I'm old enough to remember living under the system of Jim Crow. I grew up in Northern Virginia. I remember the drinking fountains. I remember places we couldn't go in. I remember impediments to being able to vote, lots and lots of things that fell out along these colored lines, redlining, not being able to buy property. And there are many of us who are old enough to remember these things, and they give us concern. And they should cause us to ask questions. They should cause us to really take care, to participate in things like today's webinar, to really try to get as much information as we can before we make these decisions. Next slide. But I think I am encouraged by the fact that there really was participation by people of color in the vaccine trials. And there have been many times in the past when that didn't happen, so that medications might be developed that hadn't been tested on people of color, who then perhaps those medications or treatments might not have the same benefit for us that they might have for others if we were not part of the trials. But I'm also encouraged by the fact that Dr. Kizzmekia Corbett, an African-American woman, was directly involved in the development of the Moderna vaccine. And I think it's an example of how far we have come, that, 70 years ago, a woman who would not have even been able to use the same restroom as researchers working on medical treatments is now heading the team that developed this vaccine. I think it gives me comfort that we still have a ways to go, but I think we have come a long way. And it gives me some comfort. And it's the reason why, I went on the website for my county and put my name on the list. And as soon as I'm able to, I plan to get my vaccination. So many people of color participated in the trials.
Thank you, Dr. Phoenix. We hope that discussing this history gives you a little bit more context to why you may be encouraged yourself to go get a vaccine, as well as some of the safeguards that have been put in place over time by the CDC and other federal entities for us to feel safer with going to get a vaccine. This video will help depict that a little bit more. So many of you may be wondering how the vaccine development process was able to move so quickly, and will rushing the vaccine make it less safe for you to get? And the answer to that is that the COVID-19 vaccine is important, and that it is getting priority in funding and evaluation. Therefore, some vaccines are building off existing vaccines and saving time in the development phase. So, although the vaccines are being developed in record time, they're still undergoing the same rigorous testing to ensure that they are safe and effective for you and those of the general public when it's everyone's turn to receive a safe vaccine. And now we'll discuss a little bit about who actually participated in the clinical trials for the COVID-19 vaccine. As you can see here, there were significant numbers of African American and Hispanic people who participated in the clinical vaccine trials, and these numbers are close to the percentages found in the US population. these significant numbers of participants for African American and Hispanic people participating is true for both the Pfizer and the Moderna vaccine trials. And as of January 28th, 2021, the COVID-19 vaccines have been administered to close to 25 million people have received their first dose. More women have received the vaccine than men, and more people over 50 have received the vaccine. And African Americans make up the smallest percentage of people who have been vaccinated, starting from late December 2020 until early January 2021.
Sydney, can you speak up just a little bit? I think you're just a little bit faint.
And when narrowed down by state, Maryland is doing a better job of vaccinating African Americans as compared to the United States as a whole. And in Montgomery County, to bring this data a little bit more closer to your own community, here's some data and information on the people who've received vaccines in your county where you live or where you work. And as of January 29th, 2021, nearly 28,000 people in Montgomery County have been given their first dose of the COVID-19 vaccine. The New York Times has put together a coronavirus vaccine tracker. We thought it was important for you to know that although we discussed the Pfizer and the Moderna vaccine today, there are still a lot of vaccines being developed, and there will be more applying for emergency use authorization in the coming weeks and months. And I'm sure you all are wondering, after you receive your COVID-19 vaccine, will you experience any side effects? And you may have some mild side effects. But as we discussed earlier in the training, that this is a normal sign to indicate that your body is building immunity to protect you from the virus. So we're going to take this moment to provide you with a firsthand account from an individual named Dr. Drummond. He is an emergency room physician in Los Angeles, California, who recently posted about getting his COVID-19 Moderna vaccine. And so he'll speak a little bit about his experience and the mild side effects that he did report.
Instagram family, happy Saturday.
We're not seeing the video, Sydney.
Saturday, because I'm not working, but as you can see, I'm about to go
Okay.
and see some patients today throughout the city of Los Angeles.
Sydney, I think you need to pause the video and take the slide presentation down
Okay.
Had a
in
number of
order
people,
for us to see it.
I'm sorry, messaging me and leaving comments saying, we haven't heard from you.
All right. Are you able to see it now?
No,
Okay.
I think you have to stop sharing, open your browser. Now we can see it.
Okay. Thank you.
Instagram family, happy Saturday. I would say that I'm excited it's Saturday because I'm not working, but as you can see, I'm about to go and see some patients today throughout the city of Los Angeles. But I figured that before I go and see some patients, I will give you all some updates. I had a number of people emailing me and messaging me and leaving comments saying, we haven't heard from you. Are you alive? Like, yeah, I'm alive, I'm good. So the last I left off, I had just received my first shot of my Moderna vaccine. And, I'd like to be very transparent with everybody about some of these reactions, right? And so I had some pretty significant like arm pain. I couldn't move my arm, couldn't bring it up like above 90 degrees. And that went on for about a day. The next day, I'll say about 24 hours afterwards, I had, muscle aches, chills, joint pains, headache. And then I developed a fever to 101.1. And then literally within 24 hours, they all went away. So in any case, that is kind of the extent of the symptoms that I had they had, a nice strong reaction about 24 hours after the vaccine, and then they lasted for about 24 hours, and then they completely went away. And that's pretty much in line with what we've seen. I would say that I was probably on the side of more severe reaction. But what people have to understand is that is a good sign. That is a sign that your immune system is working. It's a sign that I still had some immunity from the first time. And what did my body do? It saw this protein again, this spike protein, mounted a defense against it, and it went away.
All right. So we hope that seeing this video gives you a good first-person account to someone's experience as he described his mild symptoms following his Moderna vaccine. So if you all can just give me a moment to pull the presentation back up. Perfect. As Dr. Drummond described, most people have some mild side effects. Many people do have a sore arm. Some people do experience flu symptoms such as a fever, headache, or chills for about a day or two. And some people may be able to go right back to work, but others may need about a day to take off to rest, and that's okay. Some common side effects from the COVID-19 are depicted here. And you may be curious about, besides the side effects that we've discussed so far, can more serious side effects happen? If you are to experience those serious side effects, including these allergic symptoms, they happen usually within the first few minutes after the shot, and people are being asked to wait in the place where they are vaccinated for at least 15 minutes to see if any of these symptoms do develop. More people are reporting symptoms after the second shot. This can vary according to your age, and people over 55 are reporting fewer symptoms. Now, this video will describe some of those reactions I just shared with you. As of December 20th, 2020, over 270,000 COVID-19 shots have been given throughout the United States. And of those 270,000 plus shots given, the CDC has reported a handful of cases of severe allergic reactions for people receiving the vaccine. And scientific oversight of the COVID-19 vaccine process will continue to make sure that the vaccine is safe for the public, and we'll discuss one of the methods that they're using to encourage that oversight. And the CDC recommends that anyone with a history of severe allergic reactions should definitely talk with their doctor before getting the COVID-19 vaccine. So one of those oversight methods that the CDC is using to help track if people are experiencing any symptoms or side effects or adverse events following their shot is called CDC vSafe. This is a smartphone-based after-vaccine health checker for people who do receive COVID-19 vaccines. It uses text messages and web surveys from CDC for people who have gotten their vaccines. It will remind you when to get your second dose, and it will follow up with people who do have symptoms following vaccination. And here is the link for you to access vSafe. It should be being placed in the chat for you to access yourself. I've learned that it is really easy to use. So we'd like to address some things that just cannot happen from the COVID-19 vaccine. You cannot get COVID-19 from either the Moderna or the Pfizer vaccine because they are not made with what we've talked about earlier, live or killed virus. The vaccines do not change your genes or your DNA. And the Pfizer and Moderna vaccines are man-made with artificial material that is a pattern for making antibodies. There is also no evidence that getting the flu vaccine increases your risk of getting COVID-19. Now, there should be some things that you should continue to do even after you do get your vaccine, whether shot 1 or 2. You should continue to wear your mask. It can take weeks for your immunity to build up. You should keep using PPE in the group homes. And we don't know yet if people who had the vaccine can still spread the virus to others. And there are many other versions of COVID-19 that are showing up here in the United States, as well as in other countries such as the UK and South Africa. But right now, the vaccines we are using are effective against those, but that could change in the future. This video will share a little bit more about why you should continue to wear your PPE, your mask, washing your hands, and watching your distance, even after shot 1 or shot 2 of the COVID-19 vaccine. After being vaccinated, it does take time, as I shared, for your body to develop immunity, and it can take a few weeks for your body to build immunity from a vaccine. And during this time, it is still possible to contract the coronavirus. Further, the 2 vaccines that are approved in the United States, again, as we've discussed, require 2 doses, and you won't receive the full benefit of the vaccines until after you've received your 2nd dose. So even if you've received the vaccine, again, it's important to follow these 3 W's: washing your hands, watching your distance, and wearing your mask. Now to share a little bit of some specifics for how your group homes will be arranging for you to get vaccinated. Direct support professionals have arrangements that are being made between CVS, Walgreens, and your group home to create clinics for each of you that need to get vaccinated. It does not cost money for you to get the vaccine. And if you work in a group home in Maryland, you're in the highest priority to get vaccinated. Although your group homes are prioritizing their relationships with CVS and Walgreens, there still may be a delay in your exact date. We don't know these exact dates just yet, so you should make sure to stay in communication with your group home administrator regarding the specific day that you're scheduled for your vaccine. Now to share the priority tiers for how the vaccine is being distributed in Montgomery County. Direct support professionals are in this first tier, priority A or tier 1. Here are some additional groups. This tier 2 includes individuals who work in emergency medical services, urgent care, or primary care. And in tier 3, you can find individuals getting vaccinated who maybe work in prisons or detention centers or homeless shelters or dental practices. Now I'll hand it over to Dr. Phoenix to close us out and discuss some of the myths associated with the COVID-19 vaccine.
So this is your choice. And you have to make a decision about whether you feel comfortable taking the vaccine. We're hoping that we've provided enough information to you to help you with that decision-making process. It's also important to recognize that not everything that you see on Facebook or on some internet site is accurate information. So we're really encouraging you to use credible sources. The Maryland Department of Health, the Montgomery County Health Site, the Centers for Disease Control and Prevention. You can find a lot of good information there. But you need to recognize that there are a lot of myths circulating. And we want you to make your decision based on good information and not on the myths. So some things are circulating about the vaccine interfering with fertility. I just think it's important that you not believe every negative thing that you hear. So we're going to go through a few of these myths, and then at the end of that, we'll begin to take some of your questions that I hope you've been putting into the Q&A or into the chat box. So the first myth I'd like to discuss is I can get the virus from the vaccination. And this one is not true. And the reason it's not true is because there is no live virus in either the Moderna or the Pfizer vaccine. Next one. So the first people to take it are guinea pigs. And I think this flows from the fact that people recognize this is a newer vaccine technology. But at this point in time, a lot of people have been vaccinated. When we put this slide together, it was 12 million. I think it's close to double that now. So if the first people who are taking it are guinea pigs, right now there are a lot of guinea pigs out there. And most of them are walking around in pretty good shape. We talked about the number of serious side effects, 270,000 shots, fewer than 10 people with severe allergic reactions. When you crunch those numbers, the percentage of people who have a serious reaction to the vaccine is really, really tiny. Now, that doesn't mean that you won't feel something. But the fact that you feel something like having a fever, your face feels warm, your arm is sore, maybe you have chills, maybe you feel kind of bad, you want to go home and lie down and rest, those are actually good signs because that means that the vaccine is working. Next slide, please. Now, the biggest concern, I think, is that people will think that getting the vaccine is kind of a get out of jail free card, especially since we've all been cooped up for months. But you still need to wear your mask. You still need to socially distance. And the reason for that is we can't be 100% sure that you can't still give COVID to somebody else. And also because for a few weeks after you take your first shot, you know, the immunity is slowly building. So we want to make sure you're protected in the first few weeks. We want to make sure that other people are protected for the duration, because right now we don't have enough evidence to know whether you're taking the shot means that you can't transmit COVID-19 to someone else. The data is, you know, we're on the verge, I think, of being able to answer that question. Just can't answer it today. Next slide. We don't know if it's safe. So, as I said before, no deaths have been definitively linked to the COVID-19 vaccine, but we certainly have a lot of deaths that are linked to COVID-19. So you have to weigh that for yourself. You may experience mild side effects such as fever, fatigue, chills, soreness at the injection site, a sore arm for a few days. But these are normal signs. They're good signs. Next slide, please. We may not be getting the same vaccine that others are getting. You know, this one, again, is a myth. And the arrangements that your group home is making so that you as a direct support professional can receive the vaccine, you know, you're working with these Large chains like Walgreens and CVS, they are receiving doses from the same supply chain that was used to get the dose for famous celebrities like the vice president, the president, and Dr. Fauci. It's the same Moderna and Pfizer vaccines that they received. Next slide, please. Hasn't been tested enough. So, we talked about the fact that the use of the emergency use authorization doesn't mean that the vaccine didn't have to go through the same 3 phases of clinical trials, tens of thousands of people who participated in those trials. It's the same process that's used to develop any vaccine. Now, the messenger RNA part of this is a newer technology, but in some ways, that's part of the reason why we were able to get vaccines so quickly, because the messenger RNA technology is a faster process. And in the future, probably more and more and more of our vaccines are going to be made this way because it's faster. Other vaccines, like the ones we had in childhood, where you have to actually grow virus in order to make the vaccine, that process takes a long time. The lead time to get a live virus vaccine or even a kill virus vaccine is 1 to 2 years. We couldn't wait that long. So I personally am excited about the fact that we do have a newer, faster way of making these vaccines, and that will help us not only with COVID-19, but for new infections that may be coming down the pike. Next slide. The vaccine may not really work. As we've said probably 5 or 6 times already during this training session, 95% effective. Moderna and Pfizer are nearly 95% effective at preventing serious illness. So the things that you would really be afraid of, the things that might land you, on your back or on your stomach, hooked up to a respirator for weeks and weeks and weeks at a time. The things that took my brother-in-law. Those things are prevented by these vaccines. I think my natural antibodies will protect me better than the vaccine. Some people think if they've had COVID-19 already, they don't need to take the vaccine. And they may be partially right. There is some immunity from natural infection, but the immunity from natural infection is not as good as the immunity that you get from being vaccinated. So even people who've had COVID-19 already still should get a vaccine if they want to be fully protected. And that immunity will last for more time than the natural immunity will last. Next slide. So I think we're at the end of the formal presentation, and we're looking forward to answering as many of your questions as we can.
Great, thank you so much, Dr. Phoenix and Sydney. Right before we jump into questions, we're just going to do the quick little 3-question poll. So I'm going to go ahead and pull that up. If you wouldn't mind just popping in your answers real quick. 3 questions should probably take you a few seconds to complete, and then we'll jump into questions. A few more seconds for those who haven't completed the poll. All righty. So if you have any questions, feel free to raise your hand or put it in the Q&A box or the chat box. And if there aren't any questions, I might ask some frequently asked questions, and then we will be done with our training for the day. So if there's anyone that has any questions, feel free to ask. In the meantime, Sydney and Dr. Phoenix, can I ask if me and my friends have all been vaccinated, can we have a gathering with just us vaccinated folks and take off our masks and throw a little party? Would that be okay since we're all vaccinated?
I still would not recommend that you throw a party, even if you've all been vaccinated. As we said before, it can take time for the immunity to build. And then, you know, we're all worried about the possibility that new variants will emerge that are resistant to one of the vaccines that's currently been authorized for use here in the United States. That's a possibility. It's not a reality yet, but it's a possibility. And so to be safe, it would be good for everyone, even those who've been vaccinated, to continue to practice the recommendations that are helping to keep us all safe, wearing a mask, socially distancing, and avoiding indoor gatherings.
Okay. And do I still have to wear full PPE when working with someone who is suspected positive, even though I have taken my vaccine and maybe that person has taken their vaccine?
Yes, I would recommend it.
And the next question is, are the doses the same between the first dose and the second dose? Are there any dose differences?
My understanding is that the doses are the same, but the level of immunity that's achieved with each dose is different.
Okay. And can you take the vaccine in different arms? Can you get the first dose in your left and the second in your right?
There's no reason why you couldn't alternate arms,
Okay.
especially if you're continuing to experience some soreness.
The last question I had for you is, if I am pregnant or I'm planning to get pregnant, can I still take the vaccine?
So pregnancy is not a contraindication. The trials did not look for pregnant women, but kind of just by virtue of the fact that you don't always know when you're pregnant in the early stages, there were some pregnant women in the trials. So they've been watching those women to see, you know, how they fared. And so far there have been no adverse events that have been reported for the pregnant women who were in the trials, kind of. And so it's not a contraindication. And actually, since neither vaccine can be given to very, very young children, the fact that you're pregnant and you get a vaccine may be a benefit for your unborn child, because you'll transfer some of that immunity to your unborn child who is too young to be vaccinated after they're born.
Thank you. Thank you. If there aren't any other questions, we can wrap up today's session. Again, thanks everyone for joining. This will be posted on the PCC website within 48 hours, so you are free to distribute with your team members, your staff, your DSPs. Other than that, I hope everyone has a great rest of your day.
Thank you.
Thank you.